I'm Julie Grant, and this is Casandra Fulton, and we are presenting an informative video on anosognosia and some compensatory treatments.
Okay, so anosognosia is defined as a mental health condition in which a person cannot perceive their condition accurately. There are several symptoms of this disease, and it is often found as a result of a stroke that has caused physiological damage to the brain structures, typically to the parietal lobe or a diffuse lesion on the frontal temporal parietal area in the right hemisphere. A well-known example is hemispatial neglect, usually caused by right parietal lobe disruption. There is no spatial awareness of the left side, or as if the left side of their world does not exist. This is a severe mental defect, and it is the reason that many people who have schizophrenia or bipolar disorder refuse medication, believing that there is nothing wrong with them and that the problems lie with those around them. This disease is also common in people who have Alzheimer's disease. Over the years, many treatments have been tried, but it seems that bringing attention to the deficit does more harm than good. A treatment called Motivational Enhancement therapy is an approach that helps a person understand how changing their behavior can benefit them rather than trying to convince them that they are all ill. The LEAP program, which is Listen, Emphasize, Agree, and Partner, is a communication program to help you create relationships with people who are unable to understand they are ill, with the goal of helping them accept treatment. LEAP is an evidence-based communication program.
Okay, so compensatory treatments could include recording the patient to bring temporary awareness to the deficit. This would serve as a short-term solution to help the person realize that behavior changes could be beneficial. But other treatments could include checklists to create routines, setting timers. This is an example of a checklist. So you would add in here all the tasks that the person would need to do, and as their timers went off, you would shut the door. They would shut the door to let themselves know that those tasks had been completed. And also, antipsychotic medications often help with delusional thinking and self-inflicted injuries. The biggest problem is that the person must be willing to take control of the medication and scheduling if there's not a full-time caregiver available. Regular exercise, eating nutritious meals, relaxation techniques such as yoga and meditation, and getting proper sleep has also shown to help with self-care. If you have a patient or family member who shows symptoms of this mental illness, please seek out a mental health provider who is familiar with the symptoms and treatment. There's also a center called that can be accessed through Advocacy Center.org, which is a helpful resource for seeking assistance. I'm going to include on the bottom of this presentation a TED Talk about a doctor whose brother was diagnosed with anosognosia when he was, I think he was in his mid-20s. But it's very, very informative about treatment, and he was one of the people that was instrumental in creating the LEAP program. Thank you for watching, and y'all have a good summer.